Hi, I'm Dr. Rick Tytus. I'm an associate professor at McMaster University, and I'm a family doctor. And today, I'd like to discuss on a very, very important aspect, and that's the treatment of hypertension. And why am I talking about hypertension? Well, hypertension is a leading risk factor for cardiovascular disease. And cardiovascular disease is the #1 cause of death in Canada. And I've got a guest with me today, a very, very special person, and that's my wife, Rita. And people say, well, she's a woman. She can't have high blood pressure. Well, actual fact, she does have high blood pressure. So I'd like to introduce my wife, Rita. Now tell me, when you had high blood pressure, was in control, what signs or symptoms did you have?
I didn't know I had high blood pressure at all.
Yeah.
And I just found out just by accidentally checking my own blood pressure.
Now isn't that amazing? So asymptomatic. She had no idea she had high blood pressure. And when we think about high blood pressure, we also think about, well, someone that smokes. Do you smoke?
No.
Okay. Someone that doesn't exercise.
I used to exercise more.
Yeah, but you're still pretty active. You walk the dog. How many times do you play tennis a week?
3 times a week now.
Yeah, so again, she's very active. She doesn't have the risk factors. But is hypertension important to be treated?
I imagine it is.
Yeah, I imagine it is, and that's the right answer. Because there are things that we can't control. We can't control genetics. We can't control age. Now, Rita, unfortunately, genetics, her mother had a stroke, her dad had a heart attack, and he was a young man. And actually, her sister had bypass surgery, and her sister's younger than Rita. So now the question is, which blood pressure medication is Rita on? Rita, which blood pressure medication are you on?
The only medication I've ever had tried and I'm still on is my Tytus.
And is your blood pressure good now?
It's great. It's even less than 120/80.
Okay. So that certainly decreases the risk factor. Now, do you find any side effects from the medication?
The only thing that I've noticed for myself is that I haven't had any headaches. I used to get headaches every day. And that's it.
Now, I think that's a very interesting point, because how does high blood pressure present? And there is no black and white. I can't say if you have this, or that, you have high blood pressure. And it's kind of interesting because I've noticed this phenomena in a few patients. The patient said, "Oh, I feel great, doc." But then I give them the Tytus, and they come back a month or 2 months later, and their response is, "Guess what, doc? I feel better than what I felt before because I didn't know I wasn't feeling well." So like Rita, she never complained about headaches, but after she started taking the medication, she has less headaches and she actually feels better. But most importantly, with the new study, the on-target study, we know that people with increased cardiovascular risk factors, people that have diabetes with end organ damage, those people are at increased risk of having heart attacks, strokes again. So most importantly, now we've got our blood pressure controlled and we've decreased her risk for cardiovascular disease. And most importantly, she'll be around for another few years to keep me in line. So once again, I think it's so important that we have to treat hypertension. We have to address it. And hypertension is not just limited to males. It's just not limited to someone that's obese, someone that's diabetic, someone that's smoking. Hypertension can impact on anyone. So if you don't know what your blood pressure is, please get it checked. And thank you, Rita, for agreeing.